You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, everyone. How are you, Ryan?
I'm doing well. How are you?
Thanks for coming over.
Thank you for having me.
How is it to start an ambulance service?
It's funny. I get that question quite often, and a lot of people don't even realize that private entities can own an ambulance service.
I
Most of
had
them,
no idea.
yeah, most people believe it is something that either the government provides and runs and
Right.
operates, or it's hospital based. So, having previously worked for a private ambulance service in the Metro Boston area, I was very aware and familiar that they do exist. And having worked for a county-based 911 service, I actually had a lot of negative run-ins with private providers. I felt that there was a large gap in the quality of care and the quality of service being provided by the private sector in the area that I had moved in the Southeast. And at 22 years old, I got this crazy ambitious idea to go out, buy an ambulance, and see if I could not start an ambulance service on my own.
You were 22 years old and you wanted to start an ambulance service.
Yes, yes.
Why?
And I think naivety played a big part in it. I don't think I really truly understood what I bit off in terms of trying to start a business at such an age and a business too, considering the type of people we work with. This isn't just people coming in and buying coffee. This is going out and providing potentially life-saving care to patients in the communities in which I live and work around. So it was a big undertaking. So I do blame some of my age on the fact that I was willing to take the risk to go out there and start this business and to really go out there and give this a shot. I had only been in the industry about 4 years at that point. So I'd only been a paramedic, EMT paramedic for that 4 year span of time, and just felt it was the right time, the right opportunity. Happened to have a friend in the fire service who was getting out of the ambulance industry. They were only going to be doing fire and first response. And he approached me and said, I heard a rumor you're starting an ambulance service, and I've got two that are for sale right now. So the timing worked out great. And that was kind of the final push I needed to go out there and start the service.
All right. So let's backtrack a little bit. Tell me, how do you start an ambulance service? Like, what do you actually need to do? Because you mentioned some um, companies that were selling, right? In
Right.
this
So,
field. So what did
sure.
you actually do? How did you start the whole enterprise?
So it was a lot of initially it was a lot of research. It was a lot of researching because my biggest concern before even starting the ambulance service or buying my first ambulance was how do you bill Medicare? How do you collect from insurance companies? So that was the process that I was most hesitant about in terms of, is this even something I should be getting into because I just don't understand it. Fortunately, I quickly learned that there were third-party billing companies that would handle that component of the business for me to where I could focus solely on, operating, managing an ambulance service and the providers that go out on the ambulance. As far as how to start, again, more research. I looked into our state regulations, looked at the checklist and the application process to become an ambulance service and found that as long as I had, 5 EMTs or paramedics that were willing to be on my roster with the state saying that they worked for my service, and then I had a physician willing to sign off to serve as our medical director, that I was able to do that. So I actually started calling some competitors, medical directors of other ambulance services until I found one that said, absolutely, I'm interested. I'm already doing this for a few other services. And so once I got beyond that hurdle, bought the ambulance, I was able to go through the application process with the state and ultimately earned our ambulance license.
So you started with one ambulance.
Started with one ambulance, and a few months into the process, once we opened our doors and actually were starting to transport patients, I started thinking about, well, what happens one day if I come in and this ambulance won't start? So I did quickly move to a second ambulance to ensure that I had a spare unit to transition into should something happen to the primary.
I see. So how much can you serve with one ambulance? Because I imagine once you get a call and that ambulance goes to that call, you can't take a second call, right? So you
Correct.
have to do
So
it one at a time.
we had to get, and again, I probably wouldn't have admitted to this, 5, 10 years ago, but the way the process worked is back when Blackberries were the big thing, right, in technology, I had my Blackberry phone where I could do emails and accept phone calls. So I was actually the dispatcher. And at times I was driving the ambulance. Sometimes I was in the back with patients, but in between calls and transfers of patients, I was also responsible for answering the phone if somebody else called. Now, keep in mind, a lot of people are probably thinking ambulance service, 911 emergency lights and sirens, but what we were doing were predominantly non-emergency transport. So patients that were getting discharged from the ER, for example, going back to a skilled nursing facility that were unable to be in a wheelchair or ride in a passenger vehicle because of their condition, those are the types of individuals that we were transporting in our ambulance. So these were not time sensitive per se. So if we did happen to miss a call within 5-10 minutes, I could call the hospital back and more than likely, salvage the request. But we would more or less kind of start building a list of patients who needed transported, giving our best guess as to when our one ambulance could get there. And that's really how we grew it. And ultimately, as the volume kind of exceeded what one ambulance could do, that's where we started bringing on additional staff and putting on more ambulances.
When did you start this?
This was back in 2010.
So how big did you get now?
So and it's interesting, I actually sold the company 1 month ago.
Oh,
And
congratulations.
so yes, thank you. But it's a phenomenal organization. I'm very excited for the future of it. And but we got to the point where we had 250 personnel and about 50 vehicles. And those vehicles could be ambulances, paratransit or wheelchair transport units. And then we also had a few, which were my favorite. They were called the quick response vehicles or QRVs. And what those were is, SUVs or pickup trucks that were a single provider resource that would quickly respond out on emergency calls while waiting for a transport ambulance to come to the scene.
I see. So this was basically 15 years work to get to this point, correct?
Yeah. Yes, it was 15. And I always tell people, only half jokingly that, when I start another business, I don't know that I would start another 24-hour a day, 7-day a week business because say in healthcare, it never turns off. You are plugged in all the time. So it really boils down to you have to love what you do. You have to have a passion for healthcare, have a passion for people. And I certainly did, and really grew it into something quite phenomenal over the 15 and a half, 16 years that I owned the business.
Very interesting. So if you look back in the 15 years you've done this, I'm sure your present success is based on something that you had to struggle with at some point. And I'm sure you have examples of these things. Failures, setbacks, anything that didn't work out. What can you give me an example of?
So, I'll start at the very beginning, even trying to raise funds to purchase the ambulance. At 22 years old, I put together what I thought was a pretty well written out business plan with projections and industry trends and kind of the trajectory of where things were going. And I walked into the bank and I swear they laughed me out of there like I was trying to open up a lemonade stand. They said, well, that's cute, but maybe somebody else will give you, the money and the funding to go ahead and start this. So that was kind of the initial roadblock. And I always follow that story up with, I ultimately worked with that bank later on, and that bank gave me more capital for expansion than any other financial institution ever did. So I went from being laughed out of there to how much do you need for this project? So it really just shows the life cycle and the significance of building these relationships. But there are other things too. There's the regulatory component. When there's a big shift in Medicare policy change, or even at the state level, if they change policy related to items that have to be on an ambulance, that's something that can be incredibly expensive and far beyond what we may have budgeted for that year for equipment, for example. There are other things like obviously the pandemic. That was a very difficult, very challenging time in our industry because on the ambulance side, with us primarily being non-emergency, we saw an initial just drop in call volume. The patients did not need to be transported because outpatient procedures had been canceled. Doctor's appointments in many cases were canceled, or they were moving more to telehealth options versus having patients transported to these physician offices. So managing that and finding opportunity where we felt there was none, and building upon that. And I'm proud to say and pleased to say that throughout that phase of our business, we were able to maintain our staffing at 100%, even though the business could not always necessarily support us maintaining that 100% staffing level.
Yeah, that takes serious managerial skills and probably reserve funds and tricks and all kinds of miracles to happen to be in
maybe
that
a few
position.
years off your life. I don't know.
Right, exactly. But let me go back to this starting point when you're 22 years old. Did you put any money down to start this business?
I did. So I had about $10,000 to my name is what I had. And in total, I needed $25,000 to start the business. So the delta there was only $15,000 that I had to find to really get up and fund this. And I could do it at such a low cost, which is crazy to even think about in 2025 that you could start an ambulance service with $25,000.
Yeah.
You certainly couldn't do that today. But I was also free labor, and paramedics are not the cheapest personnel to have on an ambulance. And so by me also playing the role of full-time paramedic on the ambulance, that really helped us reduce our startup costs. And it was a risk, and anybody that goes into business for themselves, I mean, they know that they're taking on risks, and that was a risk I was willing to take. And the worst case scenario was I'm out the $10,000 that I had saved up all through high school and the very early part of my career, and I can move right back to being a paramedic on an ambulance working for somebody else.
Right. But still, a mindset of a 22-year-old it's very tricky, right? Because I mean, I was a 22-year-old too, and I don't know how much focus I had at that time to start a business, right? And I appreciate the fact that you like saved all this money and you push yourself to start a business that you have no idea how to do it. But still, where does this mindset came from?
Well, certainly, I mean, it begins with my parents and just the values that were instilled in me and the work ethic that was instilled very early on. I remember, I would get off the bus coming home from school, and my dad worked at a home office when he wasn't traveling for work. He was working from home, and oftentimes I would go to see him, and he would be on a work call, and I would sit in his office and listen. And I think I would just kind of absorb everything that I was hearing on the one side of the phone conversation. And I do think that that's where a lot of my business speak or my ability to communicate with people comes from, is listening to those phone calls. And then the other thing I would do, I remember when I believe I was 12 years old, and my father had a book on the shelf called How to Become CEO. And I'm like, well, that sounds great. Why wouldn't you want to be the CEO? So I go over and take that off the shelf. And it ended up being a very simple read. So I read through that at 12 years old, loved it, very simple concepts. But it was really just about what are the little things you can do that ultimately make a big impact in the organization that you work for, or the organization that you create. And so from there, my love of reading continued to grow. And I just continued to read leadership books, finance books, anything I could get my hands on, to just continue to grow in that. So I think deep down from a very early age, I knew that at some point I would want to venture into entrepreneurship. But I have to admit, I did not think it would come as early as 22.
Yeah, that's amazing. And obviously the continuing education part is very important in this field because,
Absolutely.
leadership skills are a learned skill. No, you're not born with them. You have to, acquire them somehow from somewhere or, hire a mentor or a coach or somebody that, can teach you all these things. But as you said, it's probably very important for you to have that all the setbacks you're going to encounter. What are you going to do now?
So interestingly, I was going to take the entire summer off. I was just going to spend some time at home. I made it, I think, 2 weeks after selling the business before I had to jump into something else. And I've actually launched a consulting firm because the day that I announced on LinkedIn that I had sold my business and I was no longer with the organization, I started getting messages from ambulance service owners from across the country. And some of it was, we need to talk because very few people understand what it's like to own and operate an ambulance service. And I ultimately earned a or a consulting opportunity through some of those messages. So it's a client I'm working with now, in addition to some other opportunities that have come up. So while it may be a little slow coming out of the gates, I think 3 opportunities in the first month was not a bad starting point. And then I'm also starting working with a gentleman I used to work with that does IT work, managed service agreement type work, and he's asked that I assist him with some business development and really trying to grow the business. And we really want to have a more of a healthcare focus on that side of the business. So those are kind of the two projects. And then because I still love being a paramedic, I'm also a part-time firefighter paramedic with my local fire department, and still love getting on the fire engine, interacting with the community and the patients, and still being a provider.
That's awesome. Awesome. Now to be this way, to continue being this way, and not stop on your entrepreneurship journey, it has to be something inside of you that you do every day to better yourself. What is that?
So I think part of it is I think it's how you start your day largely, that you've got to get up with the mindset, the attitude that it's going to be a great day. And also too, I always create, even though a few weeks that I was unemployed per se, creating a list for myself of what do I need to accomplish today, so that at the end of the day, I can come back and even if it's something as simple as doing the laundry, folding the laundry, putting it away, whatever the case is, no matter how kind of minor the task may be, being able to check something off and saying, I accomplished what I set out to accomplish today. So I think that's part of kind of holding yourself, personal accountability there. So I think that's it. So whether it's prepping for, the quarterly board meeting or folding laundry, I think you can take the same attitude and approach to all things in life. And I think the other piece of it is things at home have to be good. The relationships you have with your spouse, your children, those have to be in the right place at all times, because if things aren't going well at home, there's no way they can be sustainably good at work. And vice versa. If things are not going well at work, that's going to trickle into the home life as well. So you have to find the balance to keep both of those areas in check in your life and moving in the right direction. And I think those things help you remain motivated. And I also think for me, my family, I've got my wife and 3 children. That also serves as the motivation to go out and continue to do things, continue to serve, and also find new business opportunities along the way, because ultimately the fruits of my work is going to support my family and their growth, and potentially their success one day.
Yeah, that's so true. I think this professional success it's mm, very much a result of your personal success, not only in your own family, but with your own self. Because if you don't do anything to better yourself every day, you're not going to show up for other people the way you want them to be. So I
Exactly.
think it's critical, like you said, to try to master some of those skills yourself first, and then present yourself to the other people that you want to lead.
Sure.
Let's go back a little bit to something that I need to understand, and probably the audience needs to understand too. It's been an interesting development with the ambulance service billing. And I
Yes.
know that a lot of people are wondering how do you make money in this business? Because most patients, what they experience is they get a huge bill in the mail from the ambulance service, which is a completely separate claim from, their insurance company, whatever they went to the hospital or the doctor or whatever. And they get this huge bill from the ambulance service, which is mainly a self-pay bill, like they need to
Right.
pay out of pocket. How do you handle all those things? Because it's not easy to deal with this kind of patients and in the same time make a profit for yourself.
Well, that's it. So I think one of the first things to recognize about the ambulance industry is it's a highly scalable industry. That the more volume you're doing, obviously, the better you can be doing financially, and the more flexibility you have with the self-pay patient type, where you are relying on them to pay their bills. That also plays into some of the contracts that you go after as well as making sure that you're taking on contracts with quality payer mix where you can determine that they have that in advance, and also coming up with terms where, for example, if you contract with the hospital system, is that the hospital ultimately serves as payer of last resort, so that if we're providing the service, we know that we are going to be compensated at minimum at the Medicare rate for that level of service. So that's part of it in terms of planning the business strategy and the growth strategy. But then there's also the side of it that if you are doing enough volume, you have more flexibility to work with patients who may not be able to afford those large bills that they're getting for their ambulance service. And so we really took an approach where we wanted to help people to the extent that we could, and we were very big on creating payment terms. And we had some patients that were literally paying us $10 a month. And so while that wasn't necessarily helping us with cash flow, because we really needed the money that they owed us in total, it was our way of being able to be flexible with our patients, because I always saw the billing component as an extension of our patient care. That just because we got you to your final destination, whether that be a hospital ER, an operating room, whatever the case was, our care did not stop until the billing side of that was complete. And so the customer service component needs to play out throughout that process. And that's where it's challenging for smaller ambulance providers. They don't necessarily have that flexibility. They need those funds upfront, if you will, or as quickly as possible after the service is rendered. But that's again where I was pleased with where we had grown to a service, and our volume was so that we could be flexible, where we still ultimately collected those dollars, but we did it in a way that kept the patient, in mind, and the quality of our care in focus.
What is the percentage of services that are going through insurance and are paid by insurance in your field?
So on the non-emergency side, I would say probably 90% was either billed to insurance or a hospital system. And so really the remaining 10% was what we were relying on the patients to pay directly. Now, that's again where those payer of last resort, contract language would come in, because if the patient ultimately did not pay after, 3 attempts or whatever the process was for that individual contract, the hospital would ultimately turn around and compensate us for that care. So we really did have some safety measures put in place to ensure that we were collecting a certain dollar amount per transport that we were providing. Where it gets interesting is when you are providing 911 services, which we were doing in a few communities in South Carolina. It's really becomes a guessing game where you are getting a monthly subsidy check from the county government to provide those services and really to have those services ready for response. But that dollar figure is also based on the fact that we know there is a percentage of the population that will ultimately not pay their bill. So we have to offset that with what we're charging the county in a subsidy. But it becomes a real guessing game because most counties do not know the payer mix of the communities that they govern. So it really takes a lot of guesswork, a lot of experience in what we've done in in other communities to be able to model those in new markets where we would enter.
Yeah, it looks like it's a good combination between serving the community, even if the patients don't have the means to pay, and in the same time to make this business profitable.
Right.
And honestly, I mean, I think that's the assumption of our population, because most of us think that the ambulance service is something that it's kind of a government service, like it's included in the public service that we pay taxes for, right? So I think that the notion of being a private enterprise, it's a little bit surprising to most people.
It is. And sometimes, you would have a patient call in the billing department and say, well, I called the county and
Yeah.
I don't know why I got a bill from you. And you would have to explain, well, the county subcontracts the work to us. And so, yes, we are in theory the county's 911 provider. But you would have people that would try to get out of paying because they
Yeah.
weren't willing to pay a private service for services, to your point, that they thought were provided by the county.
Right. And most people think that their insurance is covering your service too. And sometimes they don't.
And that's the big surprise. I mean, there was one commercial payer in particular that we would run into where they would always leave the patients a $250
Yeah.
copay out of their bill, and we would get complaints. Well, why didn't you bill my insurance? I said, well, we did bill your insurance, but they came back and said you owed us $250, and so that was because I think a lot of people, when they think about their healthcare coverage, they don't look and say, well, what does this cover toward ambulance transport? People don't typically associate ambulance service as part of their healthcare. They look at their deductibles and what their inpatient, and those types of things, and the cost of, the pharmaceuticals. They don't think about, well, how much of this is going to be paid toward my ambulance service should I need that? And it's even worse if you go by air. If you have a helicopter or a fixed wing aircraft that has to transfer you to a hospital, you're talking about, 30, 40 plus $1,000 for that transport, and insurance is only going to cover a portion of that.
So are those services also contracted privately by the county?
They are. So more so
see.
on the helicopter side. Fixed
Mhm.
wing is more reserved for the interfacility transfers between hospital systems, but helicopters will be utilized or are utilized in the 911 setting if the patient or the incident is too far from a level 1 trauma center.
I see. So let me ask you another question. When somebody calls 911 and it's let's say it's in a more of a remote area, rural area, that they don't have a trauma center nearby, and they have maybe a community hospital that is, 30, 40 miles away. Um, who who takes that ambulance service call? Do you take it?
So the hope is that that rural community has either created their own ambulance service or they have contracted with a private provider to provide those 911 services in that community. And then from there, the decision becomes, do we transport this patient to the local community hospital for them to be stabilized and then go by flight to the more appropriate trauma center? Or do we call for flight initially to the scene and have them transferred to the level 1 trauma center and bypass that local hospital?
But there should be a medical decision, right?
But that's a medical decision. So typically speaking, it is going to be the paramedic that arrives to the scene first that is often making the decision whether that patient will be transported by ground or by helicopter. And there are some protocols depending on where you are, and especially in the rural and super rural areas where, based on the distance of the call to where the hospital is, or even sometimes the distance from the call to where the ambulance is, the dispatch center may automatically generate a request to the helicopter service to go ahead and start proceeding to that scene. And it's because the mindset is we might as well start the resource. It's easier to cancel than to request later on if we decide we do need the helicopter.
I see.
But I think you bring up a more concerning point here is that not all communities are guaranteed ambulance service. And
Yeah.
what a lot of people don't realize is in many states, EMS is still not considered an essential service. So it's not necessarily something that the government is required to provide in their communities like they are police and fire.
Oh, okay, interesting. So if you get a 911 emergency call like this, and let's say it is a medical emergency, can police or fire department send their vehicles to pick up that person to a hospital? Is that possible?
Well, and that really depends on that local jurisdiction and whether or not their
Yeah.
state health department, for example, or whoever regulates, emergency medical services, if they allow or permit those types of things to take place. So and I think that as the cost of these services are increasing and as the workforce challenges continue to impact, public safety in general, I think people are starting to realize that when you dial 911, that does not guarantee you certain services. Like I think we all grow up just assuming if we call 911, the ambulance will show up, police will show up, fire will show up, depending on what the request is. But that's not a guarantee in every community in our country. And so that's something that I think people do need to be a little more aware of in their own communities is, well, who is it that's providing the service? Is it government? Is it private? Do we even have a service that provides this?
That's very interesting. I didn't even know this. I was not aware of there are some communities that have that question even to them. But yeah, it's an interesting point. And also in the same time, I think our discussion reveals the fact that there's so much opportunity for people like you to develop a business like this in all sorts of communities around the country. Because
Absolutely.
I think, like you said, it's a very good scalable business, but it's also a business that serves the public like really well, and sometimes in an emergency situation.
Absolutely. Well,
Uh,
and the demand for the service will only increase with time.
right.
As we consider access to care issues, as we look at the freestanding emergency department model that a lot of hospitals are doing, all those patients that get transferred to the inpatient side of the hospital ultimately need to go in an ambulance. So the
Yeah.
demand for the services will continue to increase. And you're right, it's fulfilling work in the fact that you are helping people, you are helping and serving the community, but you can also grow a great business by doing so.
Who is your competition?
So one of the largest one that most people will recognize is AMR, American Medical Response. They are the largest private ambulance service probably in the country, and you typically see them. They do all the IndyCar and NASCAR, medical standbys, and they're at some of the larger sporting events that you'll see throughout the country. So that's usually the more recognizable private ambulance service that you will see out there that people will recognize.
What kind of service do most hospitals use? Like, what are those ambulances that are on the parking lots of emergency rooms there?
Yes, so most of the time for transfers in and out of the hospital, most of the time, or in a lot of cases, the hospital will outsource that to a private provider. Some of your larger healthcare systems, like an HCA, they're starting to really, delve into the ambulance world, where they're actually putting on their own resources and starting to do their own transfers. So I think, and that's a shift that I really started to see over the past year, where hospitals are really looking at ways, as the cost, like I said before, as the cost of everything in healthcare continues to go up, healthcare systems are trying to be a little more creative in how they can kind of mitigate some of those costs. And some of these larger systems that do have large transport volumes have opted to create their own ambulance services as a way to hopefully reduce their overall costs.
Yeah, obviously. Um, Now, obviously you developed a 15-year worth of a company there, and you sold at the right moment for you, I would imagine.
Yes.
Who did you sell to?
So interestingly, a few years ago, because my father and I owned the business together, and a few years ago, we had actually brought on a few strategic partners to continue to grow and expand the business. And they actually approached us at the start of the year and said, we're very interested in buying you guys out. We have an interest in moving to some additional markets, and we've got somebody that we've become familiar with in the industry that we'd really like to come in and really take this organization to the next level. And they knew that I was very transparent with my partners that I think in the next couple of years I'll be looking to probably exit, or at least exit my role as the CEO and move into some other opportunities. So the timing ended up being perfect. And like I said before, I've got three children. Two of them are young, very young. So it was just a great time. It was the right time for me to transition to an opportunity where I could spend more time with my family, but also really feel that I was leaving the business in the right hands, in the right position to continue to be successful and really positioned for exponential growth if that's the direction that they wish to take it.
Yeah, that's awesome. Now, Ryan, if you would look back to yourself with all the experience you have right now, what kind of advice would you give to yourself when you started this thing?
I would just say it will all work out, keep going, because there were certainly times in the trenches over the years where you just, I would look in the mirror and I would just say, what am I doing? Why am I doing this? The days were incredibly long. I mean, it was not uncommon to work, 16 plus hour days, several days in a row. Anytime I would try to take vacation, something would come up. Either I would get a request to put together a bid for a new opportunity, or, something else happened that would really divert my attention away from my family and where I was trying to be and the time I was trying to enjoy. So I think just continuing to encourage myself that in the end, this will all be worth it. and also keeping in mind the value we are providing to the community and the stories that we would hear from patients and their families. If ever I got really down and discouraged, I would oftentimes go and read some of our reviews just to try to pick myself up to say, the hard work is worth it because it is truly making an impact in the lives of others.
Yeah, absolutely. And I think a lot of people can vouch for this. When emergency hit, the first thing you think of it's how fast that ambulance comes to your house.
Exactly.
The first responders are something that you can't replace. In terms of speed, vehicles, but also people, like the people you work with are very important.
Absolutely.
Thank you so much for being here.
Thank you.
It's a great example of how can someone take an idea and bring it up to a success at 22 years old. And it's a great idea for maybe some other people to start this thing. I don't know, but it's just it's one of those things that it's very scalable.
Absolutely. And like I said, I'm doing consulting now. So if anybody listening has interest in starting an ambulance service, I'd be happy to help you get started.
Absolutely. I was about to ask you, how can people get in touch with you? What's the best way? And give people some connection.
Definitely through LinkedIn. I'm a pretty avid LinkedIn user. That's actually how we met. And thornefh.com. Thorne stands for thornefamilyholdings.com is the website. And that's where all the information is about the consulting services and how to contact me further.
Excellent. Good luck. And I hope your next enterprise will be as successful as this one.
Thank you very much. Appreciate your time.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.